We have someone writing in asking, what is a delayed hypersensitivity and how do you know if you have one?
Well, the delayed hypersensitivities are in contrast to the immediate. So there's two categories. Immediate, for example, you get stung by a bee and you get hives or wheezes or maybe even anaphylactic reactions. That's immediate. It occurs generally within seconds to minutes. Delayed, from exposure to expression, can be anywhere from hours to weeks. There are documented conditions, Schwartzman reactions, Arthus reactions, serum sickness reactions, that are all known to be delayed hypersensitivity reactions that occur days to weeks after exposure. This means that even the most careful history is not going to reveal delayed hypersensitivity reactions. And thanks to Drs. Gell and Coombs in the 1960s, they found that there were three different, quite different subtypes of delayed reactions. There are the antibody reactions, IgA, IgG, IgM antibodies. Those are type 2 in this four-part system. Type 3 are known as immune complexes. So this occurs when you have foreign antigen coming in, either from the respiratory, either breathed in or ingested or injected, excuse me. So you have foreign antigen coming in faster than the liver and spleen can filter them out. And the body recognizes this as foreign and makes an antibody, a reaction against the foreign item. But that combination of active offensive antibody and antigen would harm, would cause temporal arteritis, would cause type 3 immune complex reactions. So the body produces an IgM, large but rapidly producible antibody that wraps around the IgG antigen. That's an immune complex. The point is, you don't want them. You want to identify and restore tolerance if you have either a type 2 antibody or a type 3 immune complex reaction. And then we get to what turn out to be the most important. And these are T cell reactions, T like thymus, T like Thomas, but T cell reactions. These are white blood cells that react directly without antibody. And especially in regard to infections, the long-term protective immune memory is very often T cell and not B cell antibody. So delayed hypersensitivity means type 2, 3, and 4. That means B cell antibodies and or immune complexes and or T cell reactions. And the reason we developed the LRA by ELISA Act as a highly precise reproducible cell culture is to find all of those reactions in one mixed cell culture. So we will detect harmful but not helpful antibodies. LRA by ELISA Act detects immune complexes and T cell reactions. And we have a plan to restore tolerance based on those reactions, plus, if you will, a questionnaire, a health appraisal questionnaire, what we affectionately called an HAQ, which is available both online and in old-fashioned paper and pencil. And this allows us to offer a 3 to 6 month lifestyle program, often with changes in the kitchen, bedroom, and personal care, to increase the intake of the good and decrease the intake of the bad. Increase the intake of things that repair and improve your resilience, decrease the intake of things that are anti-nutrients and deplete you. So delayed hypersensitivity is complicated. It comes in 3 different aspects. We do the most advanced ex vivo. That means the reaction occurs in our laboratory just as it happens in the human body. The most advanced ex vivo LRA, the LRA by ELISA Act, It has been available since 1983, and we're going on many, many millions of cell cultures. We've reported on the precision of blind split samples. We have outcome studies, type 1 diabetes, type 2 diabetes, fibromyalgia, muscle pain, successful community-based outcome studies, real world data from real world people showing that this approach restores digestive capacity, metabolic efficiency, and most importantly, immune tolerance. So delayed hypersensitivity, very important. You want to be tolerant in your immune defense and repair system. And if you are, we celebrate. And if you're not, we can help you get back there.